There's a specific number that surprises almost every American who starts researching healthcare in Mexico. It's not the cost of a doctor's visit. It's this. Medicare, the program most American retirees are counting on, does not work in Mexico. Not partially. Not with some paperwork. Zero coverage the moment you cross the border, and yet thousands of Americans are retiring within an hour of that same border and doing just fine on healthcare. So today, we're breaking down exactly how. 3 real systems: US Medicare, Mexico's public IMSS system, and Mexican private insurance, what each one actually costs, what it actually covers, and the one advantage that only exists if you live close enough to the border to use more than one of them at the same time. Quick thing first. If you want healthcare numbers you can actually plan around, not vague reassurance, tap subscribe. It's free, and it keeps this kind of research landing in front of you automatically. Let's start with the piece almost nobody explains clearly. Option 1. US Medicare. Here's the rule, stated plainly. Medicare Part A and Part B do not cover medical care outside the United States, with a couple of narrow exceptions that mostly involve ships near the US coastline or emergencies on US soil reached faster through Canada or Mexico. Living in Mexico does not count. A hospital stay in Ensenada, a specialist visit in Tijuana, none of it gets reimbursed by Medicare. Some Medicare Advantage plans offer limited emergency coverage abroad, but that is the exception, not the rule, and you need to check your specific plan, not assume. Here's the part that actually matters for your decision. Most financial advisors who specialize in this tell retirees to keep Medicare Part A active even while living abroad, because Part A is usually premium-free if you've worked and paid into Social Security long enough, and dropping it can trigger permanent penalties if you ever move back and need to re-enroll. Part B is different. Part B has a monthly premium, $200 to $300 a month depending on your income bracket, and if you're not using US doctors regularly, many border zone retirees choose to suspend Part B and re-enroll later during a special enrollment period, avoiding the penalty entirely as long as they do the paperwork correctly. That single decision, keep Part A, evaluate Part B, is one of the most consequential and most poorly explained parts of this entire move. Option 2. IMSS, Mexico's public health system, through its voluntary enrollment program for residents. This is not the emergency-only tourist coverage. This is the real public system, and as a legal resident, you can buy into it. Cost depends on your age bracket, and Mexico's government publishes these rates annually. For someone in their 60s, annual IMSS enrollment typically runs somewhere in the range of 1,100 to 1,600 pesos a year. That's pesos, not dollars, which converts to roughly 60 to 90 US dollars a year at recent exchange rates. Per year, not per month. What you get: primary care, specialists, hospitalization, surgery, and prescription medications, all through the public system. What you should know going in, and we'll be straight with you here because that's the whole point of this channel. Wait times for non-emergency specialists and elective procedures can run weeks to months, quality varies noticeably by region and by specific hospital, and English-speaking staff are not guaranteed outside major private facilities. IMSS is a genuine safety net. It is not a substitute for planning, and almost every long-term expat we've researched treats it as a backstop, not a primary plan. Option 3. Private Mexican health insurance. This is where most financially comfortable retirees in border zone towns actually land. For a healthy adult in their 60s, a solid private plan from a Mexican insurer typically runs somewhere between $100 and $350 US dollars a month, depending on age, pre-existing conditions, and coverage level. That buys you private hospitals, English-speaking doctors in most border-adjacent cities, dramatically shorter wait times than IMSS, and direct billing arrangements with major private hospital networks. The trade-off, and this matters if you have existing health conditions, private Mexican insurers, like Insurers Anywhere, medically underwrite. Pre-existing conditions can mean higher premiums, exclusions on that specific condition, or in some cases, denial of coverage entirely if you're applying for the first time later in life. This is exactly why financial planners who specialize in this transition consistently recommend applying for private Mexican coverage as early as possible, ideally in your 50s or early 60s, before any conditions develop that could complicate underwriting down the line. Waiting until you actually need it is the single most common and most expensive mistake in this category. Now, here's the part that is genuinely unique to this channel, and the reason a border zone retiree's healthcare math looks completely different from someone retiring to, say, Central Mexico or another country entirely. If you live within roughly 2 hours of the border, Ensenada, Rosarito, Tijuana, Tecate, similar towns, you are not choosing one system. You can run all three at once, strategically. Keep Medicare Part A active as a zero-cost safety net for if you ever need major care back in the US. Enroll in IMSS for close to nothing as a backstop for routine coverage. And carry a private Mexican plan, or even just cash pay for routine visits, since private pay doctor visits in border towns commonly run $30 to $60 for your actual day-to-day care. And then there's the move nobody outside this specific geography can make, driving back across the border for anything genuinely serious. A retiree in Ensenada with a Sentry Pass is 2.5 to 3 hours from a major San Diego hospital system. Someone retiring to Lake Chapala or the Yucatan does not have that option. If a serious diagnosis comes up and you want a second opinion from a US specialist, or a procedure you'd rather have done in a US facility, that choice is realistically on the table for you in a way it simply is not for expats living 6 or 8 hours from any border crossing. Let's make this concrete with a real composite case, similar to families we've profiled in this channel's Ensenada coverage. A couple in their late 60s, retired, living in Ensenada. They keep Medicare Part A active, cost zero, since it's premium-free. They suspended Part B years ago after confirming with Social Security they could re-enroll penalty-free if they ever moved back, saving roughly $500 to $600 a month combined. They're both enrolled in IMSS, combined cost under $200 a year for both of them. And they carry a private Mexican plan for faster access to specialists, running around $250 a month combined for the two of them. Total monthly healthcare spend, roughly $250, plus routine cash pay visits that rarely exceed $50 each. Compare that to a private US health plan for a couple in their late 60s without employer coverage, which commonly runs $800 to $1,500 a month or more, even before Medicare eligibility kicks in fully, and the gap is not small. It's not a rounding error. It's often a difference of $10,000 to $15,000 a year without sacrificing quality of care, because they're 2.5 hours from a US hospital system if they ever genuinely need it. One honest caveat before we wrap up, because this channel doesn't do hype. None of this replaces a conversation with a financial advisor who specifically understands cross-border Medicare rules and a licensed Mexican insurance broker who can quote your actual health profile. The numbers in this video are real ranges based on published rates and documented expat experiences, but your specific premium depends on your age, your health history, and the specific insurer. Treat this as the map, not the final word. If you're seriously considering this move, the 3 things to do in order: confirm your Medicare Part A and B status with Social Security directly, get an actual quote from a Mexican insurance broker while you're still healthy, and talk to people already living in your target town about which private hospital they actually use. Tell me in the comments which part of this surprised you the most, whether it's the IMSS pricing or the Medicare Part B decision. Subscribe for more of these breakdowns, and I'll see you in the next video.